Good morning, doctors. Welcome again. Today we are going to discuss about trigeminal neuralgia. Let's start discussion. In trigeminal neuralgia happens, it is mainly due to trigeminal nerve compression. See the branches, it supply here, three region of supply in trigeminal neuralgia. Let's see more. The symptoms includes, firstly, we see trigeminal neuralgia in the age of 50 to 60 years in man. Man is more commonly seen. What are the symptoms? We see sudden pain, that is very severe pain, but it is not constant pain and short duration pain. Pain is very sharp, stabbing and piercing. Pain is very sharp, stabbing and piercing. Okay, when the pain occurs when you chewing something, brushing your teeth or shaving 3 times, and pain is unilateral. We can say one-sided pain. We see here one-sided. And how to diagnose trigeminal neuralgia? Trigeminal neuralgia we mainly diagnose with the help of history of patient and treatment by anticonvulsants. Drug of choice here is carbamazepine. Anticonvulsant, first drug of choice is carbamazepine, second drug of choice is amitriptyline. Okay, now let's start one MCQ. A patient 55-year-old man, remember 55-year-old man, trigeminal neuralgia start when? A 50-year male, sudden pain on one side of his face, unilateral, last up to 2 minutes, 2 minutes short duration. Pain is excruciating, feels like electric shock. He states happen when he shaves and sometimes when he chewing food. Upon physical exam, you notice the area of face. He points the area of distribution of fifth cranial nerve. He is otherwise healthy, does not take any medication. You ask him if he has ever had Shigell's. If he had Shigell's means post Shigell's there is post herpetic neuralgia. He says no. The most likely diagnosis here. So the most likely diagnosis here is trigeminal neuralgia. This is a case of trigeminal neuralgia. Okay. A 60-year-old man complains of extremely severe sharp shooting pain in his face. Describe the episodes of being like a bolt of electricity that are brought about by touching a specific area, lasts about 60 seconds and occurs many times during the day. Neurological examination is completely normal, but it is noted that the part of his face is unshaven because he fears to touch that area. What is the most appropriate initial treatment? The first drug of choice, this is a case of trigeminal neuralgia, that is anticonvulsant, and second one is amitriptyline. So guys, I hope till here it's very much clear for you. If you have any queries, any question regarding this, you can ask me. If you're new on my channel, please subscribe it, and if you like this video, put like on it. Thank you. Good day. Goodbye. That's all for today.